Good afternoon. County Executive Rich Fitzgerald here with Dr. Deborah Bogan from the Allegheny County Health Department to give our weekly update on COVID-19. There's obviously been a lot of things in the news lately regarding vaccines, regarding cases, et cetera, that we've seen. Obviously, things that are coming out of the administration in Washington. President Biden making a major announcement yesterday, talking about vaccine ramping up. And we're seeing that happen here. We're starting to see more and more. We realize we'd like to do it faster. The state would like to do it faster. The feds would like to do it faster. But we do see, the opportunities here. Dr. Bogan's going to talk a lot about the vaccine places, and we realize folks are learning a lot more about hitting refresh on your computer for different appointments you're trying to get. And again, we urge everybody's patience. The good news is, again, we're starting to see the numbers of people at least getting their first shot go up, and we're starting to feel pretty good about that. We've also seen a reduction in the number of positive cases over the last couple of weeks. I think, after the January 4th date of ending the partial reduction of things that went on, over those last couple of weeks, we've seen a reduction in hospitalizations, reduction in positive cases, probably the lowest it's been in over 2 months. So that's the good news. People are wearing their masks, people are distancing as we get hopefully through some of the tough periods of where we are. So let me turn it over to Dr. Bogan to give her update, and then we'll be taking questions. Dr. Bogan?
Good afternoon. Thank you for joining us. Thank you, County Executive. So our numbers for the past several days have been quite encouraging. We've seen daily case counts at levels not seen since the first couple of weeks of November. Our average daily case count is below 300, and it's about 120 less than last week. Our positivity rate also continues to head in the right direction. It fell to 7.8% according to the state. That's a decline of 1.6% from last week. But as encouraged as I am by the numbers, I am still cautious. We've all heard the news about the new variants of the virus, and the health department is watching closely for signs that they could be present here in Allegheny County. And if these variants become the dominant strain in our region, it could undo all of the hard work we've done to bring case counts down. So I encourage everyone to remain vigilant. Please don't let these relatively low numbers lull you into thinking it's okay to stop wearing masks or start gathering with others without physical distancing. I want to take this opportunity also to remind you that masks need to be worn properly to be effective. That is, they have to cover your nose and mouth with a tight fit across the bridge of the nose to keep droplets from escaping. The decline in case numbers has allowed our case investigating team to start calling every new case again. You may remember that at the end of November, our case investigators had to prioritize which cases they called. Cases we couldn't call, but for whom we had an email address, were sent a form to fill out. Now that our numbers are lower, we're calling everyone again and sending forms to some that we can reach. So I want to thank you all for answering our calls and completing the forms. Contact tracing also continues, and I'm happy that many of you are answering our calls. Our team is reaching about 80% of the close contacts identified by new cases. So again, thank you all. Now on to what you really want to hear about, vaccine distribution. I know there is a lot of frustration out there. Our clinics are filling up fast. The registration system from the state is confusing, and sometimes it doesn't work. You're wondering when you can get a vaccine and how you will get a vaccine. I really do hear you. We all hear you. We are frustrated here too, and we're doing everything we can to work with the state, the county staff, with area hospitals, and with community groups to get the vaccine out as quickly and as easily as possible. Our biggest challenge here at the health department is supply. We have too few vaccines for so many who want it. The vaccine appointments we opened yesterday for those 65 and over were filled in less than 30 minutes. Our staff is going through records of everyone who registered and canceling appointments for anyone who is not eligible, so that we can make those appointments available to those who meet the current focus of our local efforts. I know that this puts at disadvantage those who don't have access to the internet, those who can't navigate the sometimes tricky registration site, and those who can't spend all day at the computer clicking on links in hopes of getting an appointment. The health department is working on better solutions as we speak. We're making plans to take vaccine right into senior high-rises and at-risk communities to vaccinate residents where they live. We're setting up a phone support registration system and are looking to improve and streamline our registration processes. These steps unfortunately take time, and they take a larger and more reliable supply of vaccine. Part of our frustration is our inability to plan around a known quantity of vaccine. We don't know how much we'll get each week, so we can't plan far in advance. We don't know how much we're getting in Allegheny County because the state doesn't know how much it's getting from the federal government. But I hope that this will start to change very soon. The good news is there is vaccinations happening all over our county. All of our health systems, UPMC, AHN, Heritage Valley, and St. Clair hospitals, and some of our community pharmacies are offering vaccines. The health department was sent enough doses of vaccine this week to ensure second doses while continuing first dose vaccination opportunities in Monroeville and at other pods we establish. Overall, vaccine providers in Allegheny County received 50,000 vaccine doses last week. That's double from the prior week, and that's great news. We'd like to see that continue or increase to meet the demands of the county. I said last week, but it is definitely worth repeating, we have so many willing and able people and organizations at the ready to help vaccinate. The rate limiting step remains our vaccine supply. So while we wait for the national supply to increase, here are some things that each of you can do to help our vaccination efforts in Allegheny County. First, please be patient. I know you've heard this before, but we're working as fast as we can through the challenging process. Second, a problem we are having with providing vaccines at our Monroeville site is the number of people who register for appointments but don't fit the current criteria. The Monroeville site is only able to vaccinate Phase 1A healthcare workers and those 65 and older. The health department staff is checking all registrations and canceling those who don't meet this criteria. And this is very time consuming. This delays our ability to vaccinate those who truly need it, and this really needs to stop. Third, it'd be great if you can help your grandparents, help your parents, help your neighbors. I know the online registration system is not easy to navigate and can be quite frustrating, even if you're a little computer savvy. So imagine if you're not computer savvy. So until we're able to provide phone support, we need you all to help people who need the vaccine to register for them. So check in and find out if someone you love needs help. Together, we can get those most in need protected immediately. Fourth, tell anyone who will listen to you that you plan to get the vaccine. I know there is a lot of people in our community who are hesitant about these vaccines. And these hesitancies are real and must be acknowledged. But we also know that if someone hears from a friend or a trusted community member that they plan to get the vaccine, it can help them decide to get vaccinated too. So please be a vaccine ambassador for the county. Finally, continue to practice COVID safety. Until we get our community vaccinated, we need to continue to wear masks, to keep physical distance, to wash our hands, and follow isolation and quarantine guidelines. As a community, we are stronger than we were a year ago, and we need to keep staying strong and staying together to get through this and to return to normal. So thank you again for joining us, and please remember to stay safe and be kind. Thank you for your time.
The first question that we have, we received a similar one from both the Post-Gazette and the Pittsburgh Business Times, so I'm going to try to combine the two. You have talked many times about equity and equitable distribution. Can you talk a little bit about what the county is doing to get vaccines specifically to Black members of our community or people who don't have access to the internet or other underserved populations?
Yeah, thanks. I did address that a little bit in my comments, but this is a really important topic. So we are working with organizations, including our healthcare organizations, to get vaccine into more areas of the county. There are more vaccine providers getting approved all the time by the state, which again increases distribution of where vaccines will be available. We are, at the health department itself, planning pods or points of dissemination, of dispensing rather, for lots of neighborhoods and through lots of programs, and we are really working on that diligently. And we are finalizing a phone support registration system to address that exact question about access and how to reach people who don't have computers.
This next question is from WESA. The county and other vaccine providers have said increased supply of vaccine is desperately needed. Do you have an estimate of how much more local providers need right now to work through phase 1A? There's a follow-up question. Governor Wolf has said the state has received 1.5 million doses, but we need 8 million to inoculate the 4 million in that category. Do we have a comparable gap here in the county?
I'm sure we have a comparable gap in our county. You know, we estimate that about a third of our community now meets the phase 1A criteria set by the state. And so we have a lot of people who fit into that category who need to be vaccinated.
This next question is from the Tribune Review. Can you tell me what your thoughts are on the Biden administration's vaccine approach so far and the president's goal to have at least 100 million vaccinated in his first 100 days in office? Do you think the new administration will make a difference in the speed and efficiency in which vaccines are distributed in Pennsylvania?
Yes, I was very glad to see yesterday when President Biden announced actually an increase on the 100 million doses in the first 100 days. And I think we're already seeing that, which obviously averages 1 million doses a day. And it looks like early on they're doing 1.5 million to 2 million doses a day. And according to the according to President Biden, they're going to be ramping up by about 16 or 17%, even above that number. President Biden also made, I think, a very bold announcement saying that he anticipates having 300 million Americans vaccinated by the end of the summer. And obviously that would be the point in which things could really open up and we get back to, a normal operation. So I think the fact that the president and his team have just focused on this and really made this a priority, meeting with the manufacturers, putting plans together to do distribution. Obviously they inherited something with a lot of challenges, as we all know. And it looks to me like that is going to improve. The other thing that he said that kind of dovetails on what Dr. Bogan said is predictability. He has indicated that for at least the next 3 weeks, there will be a predictable supply, an increased predictable supply that states can anticipate and make plans around. I think that's also something as people make appointments and people try to schedule things without that predictability makes it difficult. So I am optimistic that where they're going with their plans, and hopefully they'll be able to carry them out and we'll all benefit from that.
This next question is from WESA. Last week you had talked about that there were not large amounts of COVID vaccines sitting around in freezers in Allegheny County, and you also said the county has plenty of people who can administer vaccinations, as you repeated again today. State data shows that more than 181,000 doses of the vaccine have been distributed to the county, but less than 77,000 of those doses have been administered. Is that a delay in administering the vaccine a reporting issue, or is it possible that providers are hanging on to vaccines so there's enough to administer a second dose?
So I think there are some limitations in the data on the state. So for example, I'm just going to remind you that if you work in Allegheny County and got vaccinated at our healthcare providers like AHN or UPMC, but you actually live in a surrounding county, your numbers are counted in that county, not where you got the vaccine. So there's some discrepancies on the numbers from that state. But what I do know is that because no one knows what vaccine they're going to get next week, right? We're all waiting to find out what we're going to get. We're keeping vaccine on hand to make sure we can cover all the appointments that we've given out. So I think some of the difference we're seeing is certainly all of us holding on to vaccine to ensure that anyone who has an appointment has a dose of vaccine allocated to them. And I think that's really important. And so, for example, the vaccine slots we opened yesterday, we knew we had vaccine for those, so we could open them up. If we get more, then the county will open up pods to do that. But we always need enough to cover like a week to 10 days in planning so we can open up appointments and give people those appointments. So that's what's, I think, in storage, not necessarily second doses or really being held. It's literally dedicated vaccines for people who have appointments coming up.
We have two follow-up questions related to the pod in Monroeville. One from WESA asking whether people who are not residents of Allegheny County can go to the Monroeville Clinic for vaccination as long as they meet the minimum criteria set up for the pod.
We have not been canceling appointments for people who live out of county who meet the criteria.
And secondly, what do you recommend, this is from WTA, excuse me, what do you recommend for people in 1A with high-risk medical conditions but who are not 65 yet, who want to get vaccinated?
Yeah. You know, I appreciate that everybody who is 1A would like their vaccines immediately. We did have to sort of set some prioritization, and we did that based on the fact that we know 65 and older are much more likely to get hospitalized and much more likely to die if they get COVID-19. And so there are, I hope as we get more vaccine, we will be able to open up fully to all of the 1A criteria. I do want to remind you that there are other vaccinators other than the county health department. We're actually a small vaccinator compared to some of our health systems. So I encourage you to look to those places as well. We're moving as quickly as we can to vaccinate as best we can.
The next two questions are regarding the canes, so I'll direct those to the county executive. This first question regarding the canes is from the Post-Gazette. How many workers at cane facilities have not yet gotten shots? And what is the county doing to encourage them that the vaccine is safe and necessary?
I don't have an exact figure on how many people have not. I know through the first round we had a little over 60% of the employees and almost 90% of the residents who went through and got the vaccine, got their shot. There were some employees that weren't there and indicated that they did want to get a vaccine, and so on the second go round, I know there have been a number of, well, over 40 I believe already, that have gotten their shot as the second go round has gone through. You know, we just want to encourage everybody to get their vaccination. It's one of the reasons why I participated in the trial last summer. I thought it was important to show the importance of being part of the scientific experiment, and then, you know, I wouldn't ask people to do something that I wasn't going to do. It also is something that we know is going to protect not just the employee, but their families and the residents and the community that they're there. So I think Dennis Biondo, Director Biondo, will probably have some figures that we'll be able to put out in the next few days as more and more employees do get the vaccine. And again, we're going to encourage people as much as we can to go ahead and get that shot.
And the other question from WESA was, do we know how many residents and staff at the cane facility so far have decided to get the vaccine?
And it was a little over 60% on the first go round of employees and close to 90% of residents. And after the second go round, again, Director Biondo will be able to provide that information in the coming days.
This next question is from WPXI. Data suggests that the county is in a much better place with testing than earlier in the pandemic. Do you believe rapid testing needs to be made more widely available?
I've said from the very beginning, the more testing we have, the better we can contain this virus. Rapid testing is great, and if we can get more rapid testing that's accurate, that's always a good thing.
This next question is from the Pittsburgh Business Times. Earlier this week, West Virginia set up a registration system for the entire state. Pennsylvania, on the other hand, does not have that. Instead, requires people who want the vaccine to contact providers directly, which has become obviously very frustrating for residents and which you have referenced. Do you think a centralized location would be better, or do you see any other ways that the process can be modified moving forward?
You know, I recognize that people are frustrated with the current system of sort of trying to find a location. And I think there are lots of opportunities to improve it, and we're working through those. And I know that the new Secretary of Health and the governor and everybody's really trying to address this. So I hope we'll improve the processes soon. How that is done, I think, remains to be answered.
These last two questions are from WESA. Dr. Bogan, for most of last week, you asked providers in the county to continue focus on vaccinating healthcare workers due to the limited supply of vaccine. And you also said the county would focus on vaccinating healthcare workers as well. But on Friday, the county opened up vaccination slots to people 65 and older. Was there something that caused that change?
As you recall, on Tuesday of last week, the state changed the guidance it gave all of us in terms of vaccination priorities. And as the state changed their vaccination plans, we took a couple of days and reflected on those changes and wanted to really adapt our plan to be consistent with the state. And that's why we changed our plans on Friday.
And this final question, you've spoken before about low transmission rates within schools that are teaching in person. As many local districts have now reopened, have transmission rates within schools remained low?
So yes, I have said that multiple times, and I want to say I was really happy to see that the CDC put out an MMWR report this week about K-12 transmission in schools, and it was very encouraging. So I encourage you all, if you haven't seen that MMWR report released this week about K-12 transmission, that you refer to that as evidence to support those assertions in the past and currently.
That was the final question. If there's any closing remarks.
Well, thank you, Dr. Bogan, and thank you for the diligent work you and your team continue to do, not just in Monroeville, but with all of our chief medical officers and all the healthcare facilities that are doing what they're doing, to work with the state to try to streamline this. And again, we do know that is frustrating how people have to go on the websites and try to make multiple appointments and find out where the vaccine will be. The good news is, let me just say this, I really appreciate the patience and cooperation that the community has shown throughout this process. With all the challenges we have, we see that Allegheny County leads the state in the number of vaccinations that have occurred. So that's something I think, again, we can be proud of. And it really is the partnership of our healthcare facilities, our pharmacies, our community organizations, et cetera, that are part of that. And also really thankful for all the folks who have come forward to volunteer sites and personnel to be able to do the vaccinations once we get as much product. So we're hopeful again that the administration has talked about ramping things up out of Washington and through the two manufacturers that are present right now. Obviously, if a third and a fourth one come on with Janssen and AstraZeneca, that obviously would add to the supply of where we are. The other good thing is a lot of us, and I certainly was one, and was very pessimistic about where the numbers in January would be after a very, very difficult, challenging November and December. And coming through the tough holiday season, people were very cooperative in wearing their masks and avoiding the gatherings and doing the things that we know were tough to do, but were the right thing to do when it came to protecting our health. So we've seen much better numbers, as Dr. Bogan talked about. The percentage of positivity has come down. The total number has come down. I know our hospitalizations, talking to the folks at our hospital facilities, have come down. So, kudos to everybody who's really worked on this. So we still have some challenges ahead. So as Dr. Bogan said, we can't relax. You can't just take off your mask just because the numbers are coming down. We still have some challenges ahead. But as we get more and more people vaccinated and we get safer, we're going to get to this, hopefully, as the president said, by the end of summer, and if we're lucky, maybe even before. So God bless it.